Recent research shows that some of the most common vitamins seniors take every day may actually be increasing the risk of heart problems, quietly, slowly, and without warning. If you're over 60, your heart has already worked hard for decades. Every heartbeat, every breath, every step you've taken, your heart has been right there with you. But the truth is, your heart becomes more vulnerable with age. And certain vitamins, though well-intentioned, can push it closer to danger. As a doctor, I've sat with countless older adults who take supplements faithfully. They avoid junk food, try to stay active, and genuinely want to protect their health. But when I look at their supplement list, I often see the very things that may be undermining their efforts. Not because the vitamins themselves are evil, but because of how they're used. In this video, I want to walk you through 7 specific vitamins or supplements that I'm urging seniors to stop taking, or at least rethink, because they could be damaging your heart. These are real risks I see in my clinic, and they're almost always preventable. You'll learn why certain popular vitamins can harm your heart, how excess doses or poor combinations affect aging arteries, what the science says about these risks, and most importantly, what safer alternatives or habits can help protect your heart instead. Let's begin. Vitamin E, the blood thinner that backfires. Vitamin E was once hailed as a heart savior. It's an antioxidant, right? That must be good. And yes, in food form, it can be. But the problem starts when people begin taking high-dose vitamin E supplements without medical supervision. Why is that a concern? Vitamin E acts as a blood thinner. In moderate doses, this may be helpful. But when taken in excess, often more than 400 IU per day, it can interfere with the body's clotting ability. For someone taking aspirin or a blood thinner already, this creates a dangerous situation. I've had patients who developed internal bleeding, spontaneous bruising, or even minor strokes that were linked back to high doses of vitamin E. Newer studies have also shown that high doses may increase the risk of hemorrhagic stroke, which is bleeding in the brain. The other concern is that vitamin E doesn't act alone. It interacts with vitamin K and other nutrients that regulate clotting and blood pressure. When taken in isolation or in large doses, it can throw your body's balance off. What to do instead? Focus on vitamin E from natural food sources: nuts, seeds, spinach, and avocados. They deliver vitamin E in a form your body recognizes and can use properly. And unless your doctor specifically recommends a supplement, avoid high-dose vitamin E pills. Calcium, the artery hardener. Calcium has become a daily habit for many seniors. The goal? Strong bones. But here's the part that often gets overlooked. When you take calcium supplements, especially large doses without the proper cofactors, your body may not direct that calcium to your bones. Instead, it can deposit it in your arteries. Yes, the same calcium meant to protect your bones may end up hardening your arteries. This process, called vascular calcification, reduces artery flexibility and raises the risk of heart attack. I've seen this on scans of patients who took calcium every day for years, thinking they were doing something good. The missing piece here is vitamin K2. Vitamin K2 helps direct calcium into your bones and teeth and away from your arteries. Without K2, calcium floats freely, and when your body doesn't know where to put it, it takes the path of least resistance. That often means your blood vessels. What to do instead? Get calcium from food sources first: leafy greens, almonds, sardines, dairy. If your doctor recommends a supplement, look for one that includes K2 and magnesium. And always get your blood levels checked before starting long-term supplementation. Iron, the oxidative stressor. Iron is essential, but too much iron, especially in seniors, can be harmful. I've met many older adults who take iron just in case, thinking it will boost energy or support their blood. The truth is, after menopause, women stop losing iron monthly, and men never lose it regularly. That means iron builds up in the body with age. Excess iron can cause oxidative stress, damaging your cells, tissues, and especially your blood vessels. This stress creates the perfect environment for inflammation and plaque buildup. It's like rust in your arteries. High iron has been linked to increased heart disease risk, especially when it's not balanced by proper antioxidants. What to do instead? Only take iron if you've been tested and confirmed to be deficient. Don't guess. And if your levels are fine, avoid multivitamins or fortified foods with added iron. Vitamin B6, the nerve and heart disruptor. B vitamins are important, but some seniors are getting way too much vitamin B6. It's found in multivitamins, energy drinks, fortified cereals, and many supplements marketed for brain support. When all of those stack up, the result can be chronic overdose. High levels of B6 can damage nerves. Seniors may feel tingling, burning, or weakness in the limbs, but it doesn't stop there. Too much B6 can also interfere with your heart rhythm. I've seen cases where patients had palpitations or arrhythmias that began after starting a high-dose B complex. The danger is compounded by the fact that B6 toxicity can take months to show symptoms, and it's rarely suspected. What to do instead? Stick to no more than 100 milligrams per day, including all sources. If you're taking multiple supplements, add up the B6 totals. Often, reducing your intake will resolve symptoms within weeks. Vitamin D, the calcium shifter. Vitamin D is essential for immune and bone health, but lately I've seen a trend of oversupplementation. Many seniors take high doses, 5,000 to 10,000 IU per day, without ever testing their levels. And while deficiency is harmful, too much D is dangerous too. Excess vitamin D increases calcium absorption from the gut. If your calcium intake is already high, this can lead to hypercalcemia, too much calcium in the blood. That calcium has to go somewhere. Often it ends up in your arteries, kidneys, or heart tissue. Symptoms may include nausea, confusion, arrhythmia, and high blood pressure. What to do instead? Have your vitamin D levels tested regularly. For most seniors, 1,000 to 2,000 IU per day is sufficient. Balance it with vitamin K2 and magnesium to avoid imbalances. And remember, sunlight and diet play a role too. Niacin, the cholesterol fix that backfires. Niacin, or vitamin B3, was once a standard treatment for high cholesterol. But recent research has revealed that high-dose niacin may do more harm than good. It can raise your HDL, which is good, but it also increases the risk of stroke, insulin resistance, and liver damage. In my practice, I've seen seniors taking 1,000 milligrams or more per day, often unaware of the risk. They were told years ago it was good for the heart, but today, guidelines have changed. Unless prescribed for a specific reason, high-dose niacin isn't recommended for seniors. What to do instead? If your cholesterol is high, focus on lifestyle first. Diet, exercise, fiber, healthy fats. If medication is needed, talk to your cardiologist. But don't use niacin as a self-treatment. Multivitamins with stimulants. The hidden trigger. Many seniors take daily multivitamins labeled for energy or focus, but the problem lies in the fine print. Some of these blends contain stimulants, green tea extract, caffeine, ginseng, or synephrine. These can raise heart rate, increase blood pressure, and interact with your medications. For someone over 60 with a sensitive cardiovascular system, this is a recipe for arrhythmia or hypertensive episodes. The real concern is that these ingredients aren't always clearly labeled. You might think you're taking a simple vitamin when it's actually a stimulant cocktail. What to do instead? Choose plain, single-ingredient supplements if needed. Avoid blends that promise energy or focus, and always read labels carefully. After 60, your body changes. Your heart, your kidneys, your digestion. Everything becomes more sensitive. What worked in your 40s might be harmful now. Supplements can help, but only when they're needed, and only when used wisely. These 7 vitamins and supplement habits aren't bad in isolation. The problem is in the dose, the form, and the context. When taken carelessly, even helpful nutrients can become harmful. You have the power to protect your heart, not just with what you avoid, but with the choices you make every day. Eat whole foods. Get tested before supplementing. Choose balance over extremes. And listen to your body when it whispers. Thank you for watching. If this video helped you, please like it to support Glowing Age. And don't forget to subscribe. We're here to help you age stronger, live wiser, and protect your health, one informed choice at a time.